Ampun.
The city of Surakarta, better known as the city of Solo, is famous for its slogan, the spirit of Java, which means the soul of Java, a city that adapts its image as the center of Japanese culture, people who maintain local wisdom with global thinking. Asia Surakarta University is present as one of the universities in the city of Surakarta, which adds to the charm of the world of education in Nusantara. The University of Asia Surakarta has gone through a long historical process of civilization in transforming forms. Founded in 1966, starting from the Asia University Midway School, then in 1981, became the Asia Surakarta School of Nurse. In 1997, became Midferry Academy Asia Surakarta. In 2002, established the Asia Surakarta Nursing Academy. In 2005, the College of Nursing was established Health Science, Asia Surakarta, and in 2020 has been transferred into Asia Surakarta University. Currently, Asia Surakarta University comes with 3 choice of faculties and 11 study program. Faculty of Business and Economy with study program, Bachelor of Entrepreneurship, excellent in business innovation skill and creativity based on digital, Bachelor of Retail Management, excellence in technology-based retail management, Faculty of Science and Technology, with undergraduate program in Information System and Technology, excellent in System Service and Information Technology, with the integration of artificial intelligence, Faculty of Health Science, with study program, Bachelor of Hospital Administration, excellence in digital-based hospital administration, Bachelor of Midwifery, excellence in Tibun Nabawi, Diploma for Physiotherapy, excellence in Geriatric Physiotherapy, Diploma 3 Nursing, excellence in Wound Care, Bachelor of Nursing, excellent in Disaster Management. In addition, the University of Asia Surakarta has nurse provision, midwife provision, and midwifery transitional programs. Educational activities at the University of Asia Surakarta are supported by sophisticated and modern facilities, equipped with a studio, smart classroom, discussion corner, digital library, mini hospital, Asia Pratama Clinic, and various laboratories that make learning activities possible anytime and anywhere. Asia Surakarta University. The city of Surakarta, better known as the city of Solo, is famous for its slogan, the spirit of Java, which means the soul of Java, a city that adapts its image as the center of Japanese culture, people who maintain local wisdom with global thinking. The city of Surakarta, better known as the city of Solo, is famous for its slogan, the spirit of Java, which means the soul of Java, a city that attaches its image as the center of Japanese culture, people who maintain local wisdom with global thinking. Aisyah Surakarta University is present as one of the universities in the city of Surakarta, which adds to the charm of the world of education in Nusantara. The University of Aisyah Surakarta has gone through a long historical process of civilization in transforming forms. Founded in 1966, starting from the Aisyah University with first school, then in 1981, became the Aisyah Surakarta School of Nurse. In 1997, became Midferry Academy Aisyah Surakarta. In 2002, established the Aisyah Surakarta Nursing Academy. In 2005, the College of Nursing was established Health Science, Aisyah Surakarta, and in 2020 has been transferred into Aisyah Surakarta University. Currently, Aisyah Surakarta University comes with 3 choice of faculties and 11 study programs. Faculty of Business and Economy with study program, Bachelor of Entrepreneurship, excellent in business innovation skill and creativity based on digital, Bachelor of Retail Management, excellence in technology-based retail management, Faculty of Science and Technology, with undergraduate program in Information System and Technology, excellent in System Service and Information Technology with the integration of artificial intelligence, Faculty of Health Science with study program, Bachelor of Hospital Administration, excellence in digital-based hospital administration, Bachelor of Midwifery, excellence in Tibun Nabawi, Diploma for Physiotherapy, excellence in Geriatric Physiotherapy, Diploma 3 Nursing, excellence in Wound Care, Bachelor of Nursing, excellent in Disaster Management. In addition, the University of Aisyah Surakarta has nurse provision, midwife provision, and midwifery transitional programs. Educational activities at the University of Aisyah Surakarta are supported by sophisticated and modern facilities, equipped with a studio, smart classroom, discussion corner, digital library, mini hospital, Aisyah Pratama Clinic, and various laboratories that make learning activities possible anytime and anywhere. Aisyah Surakarta University also prioritizes Islamic values in the learning process to produce graduates who excel intellectually, socially, and spiritually. There are Islam and Muhammadiyah program. Aisyah University of Surakarta is meant to deepen religious knowledge for students. University Aisyah Surakarta provide one-day service, a service that makes it easy for you to become a student of Aisyah Surakarta University. Aisyah Surakarta University provide opportunities to excel and win scholarship. Scholarships are obtained from Aisyah Surakarta University, Nazismu, government partner of Aisyah Surakarta.
Just one more step. You can get all these conveniences by registering yourself through this link. Aisyah Surakarta University, leading in character qualities.
Let's join with us at Surakarta Aisyah University, leading in character qualities. The city of Surakarta.
Distinguished guests, ladies and gentlemen, we are going to begin in 10 minutes later. Allow me first to inform the rules we must obey during this international webinar session. First, participants are expected to always turn on the camera and please turn off the microphone during the webinar session to anticipate the noises. And second, please use your real names on the Zoom account and dress modestly. To all the participants who disobey the rules, will be removed from the meeting room. And the third, please make sure that all of you have registered in the registration link that we have shared before. And fourth, certificates will be given to all of the participants who have registered and filled the initial absence and the evaluation absence. So please pay attention for writing the correct name. The link will be shared on the Zoom room and the YouTube live chat later. All of the certificates can be downloaded in the website for Aiska University under the address of www.aiska/university.ac.id. The committee doesn't accept any complaint of error in writing names, identities, and disclosure certificates of participants. During discussion session, we will invite you all of the participants to ask questions by writing on the chat room or raise your hands, and then we will have invite to ask questions directly in front of the camera. Well, ladies and gentlemen, that's the rule that we have must to do. Hopefully, all of the participants can obey the rules and make today's webinar run well without any troubles and obstacles. Thank you. As we are going to begin, we would like to invite you all of the participants to enter the Zoom room or YouTube channel of Aiska Official. Distinguished guests, ladies and gentlemen, as our warmer greetings in international webinar under the theme of the role of health, business, and technology in society 5.0. Assalamualaikum warahmatullahi wabarakatuh. Firstly, let's thank and pray unto our God who has been giving us His mercies and blessings until we can attend this program without any troubles and obstacles in this happy place and time. May salawat and salam always be presented to our Prophet Muhammad Sallallahu Alaihi Wasallam, who has guided us from the darkness to the lightness. The Honorable Ministry of Tourism and Creative Economic of Republic Indonesia, Dr. Al-Hajj Sandiaga Salahuddin Uno, BBA, MBA, the Honorable Rector of Aisyah University of Surakarta, Nurse Riani Wulandari, Master of Nursing, the Honorable all of deans and lecturers, and all of the speakers today. Distinguished participants on this international webinar session, ladies and gentlemen, good morning to you all and welcome to our blessed virtual room on the agenda international webinar. We are very honored and happy to have you all here today on Saturday, 28th of October 2023. And we are here, Aiska University International Webinar Session, talking about the role of health, business, and technology in the Society 5.0. This event is organized by 4 countries, Indonesia, Asia, Aisyah Surakarta University, Mahsa University of Malaysia, Moscow City University, Russia, and Public Law and Political Science, Morocco. Well, ladies and gentlemen, for warming up this morning, can we give a big applause of this event? Thank you. My name is Zulfa Rasida and I'm honored to be the Master of Ceremony today. Honorable ladies and gentlemen, on behalf of the organizing committee, allow me to extend our gratitude and also our grateful feeling that we are here healthy, and also the opportunity that we can get gathered here in this virtual room, and we are here together to discuss various important issues in this global trend in health, business, and technology. Our event today will consist of opening ceremony for the first reciting Holy Quran, and the next is welcoming speech, and the next is singing national anthem, continued by Mars Sang Surya and Mars Aisyah song. And then we will have welcoming speech for our rector, Aisyah Universitas of Surakarta. And then followed by welcoming speech from our Ministry of Tourism and Creative Economic of Republic of Indonesia, Dr. Alhaj Sandiaga Salahuddin Uno, BBA, MBA. And the next is our core agenda, that is keynote speech and discussion, followed by photo session that we will guide for our moderator, and the last is closing. The Honorable distinguished guests, ladies and gentlemen, we are going to start our program today by reciting Holy Quran by Kurniawan Trikuncoro. He is one of student of nursing, Aisyah University of Surakarta. Time's yours.
Assalamualaikum warahmatullahi wabarakatuh. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم تبارك الذي بيده الملك وهو على كل شيء قدير الذي خلق الموت والحياة ليبلوكم أيكم أحسن عملا وهو العزيز الغفور الذي خلق 7 سماوات طباقا ما ترى في خلق الرحمن من تفاوت فارجع البصر هل ترى من فطور ثم ارجع البصر كرتين ينقلب إليك البصر خاسئا وهو حسير ولقد زينا السماء الدنيا بمصابيح وجعلناها رجوما للشياطين وأعتدنا لهم عذاب السعير وللذين كفروا بربهم عذاب جهنم وبئس المصير صدق الله العظيم wassalamualaikum warahmatullahi wabarakatuh.
Entering the next agenda, singing national anthem of Indonesia Raya, continued by Mars Sang Surya and Mars Aisyah. To all the audience are kindly in the right position in front of the camera. Ladies and gentlemen, it's time to have welcoming speech from our rector of Aisyah University of Surakarta. So we would like to invite Miss Nurse Riani Wulandari, Master of Nursing, Science yours.
Assalamualaikum warahmatullahi wabarakatuh. The Honorable Minister of Tourism and Creative Economy of the Republic Indonesia, the Honorable Speakers, and distinguished international webinar participants. Let us give thanks to Allah Subhanahu wa Ta'ala who has been giving us blessing and mercies so we can attend and participate in this international webinar organized by Aisyah University of Surakarta. Greeting and salutation upon Prophet Muhammad SAW, who has taught us respectfully in order to attain happy and prosperous life in this world and hereafter. Distinguished guests, we want to say a huge thank you to the Minister of Tourism and Creative Economy of the Republic Indonesia and all honorable speakers for taking their time to share knowledge and experiences about the role of health, business, and technology in the Society 5.0 in this international webinar. This international webinar organized by Aisyah University of Surakarta is entitled The Role of Health, Business, and Technology in the Society 5.0. This term was chosen because recently the Society 5.0 refers to the social level that's caring for well-being of the human and that the needs and expectation of all segments of society will be met with help of the technological opportunities offered by Industry 4.0. The Society 5.0 concept seeks to create a balance between technology as a trigger of economic, health, and technological developments as a means to improve people's life and social welfare. The implementation of Society 5.0 includes the processing of massive data in cyberspace collected from human activities and other physical objects, and the processed product will form the basis of this session that creates more efficiency, security, comfort, health, and more balanced distribution of welfare. In Society 5.0, a huge amount of information from sensors in physical space is accumulated in cyberspace. In cyberspace, this big data is analyzed by artificial intelligence, and the analysis results are fed back to human in physical space in various forms. In the past information society, the common practice was to collect information via the networks and have it analyzed by humans. In Society 5.0, however, people, things, and systems are all connected in cyberspace, and optimal result obtained by AI exceeding the capabilities of humans are fed back to physical space. This process brings new value to industry and society in ways not previously possible. It can be said that the environment surrounding the world is in an era of drastic change. As the economy grows, life is becoming prosperous and convenient. The demand for energy and foodstuff is increasing. Lifespan is becoming longer, and the aging society is advancing. In addition, the globalization of the economy is progressing. international competition is becoming increasingly severe, and the problems such as the concentration of wealth and regional inequality are growing. Social problems that must be solved in opposition to such economic development have become increasingly complex. In the face of such major change in the world, new technologies such as IoT, robotics, AI, and big data, all of which can affect the course of society, are continuing to progress. Society 5.0, a reality as a new society that incorporates these new technologies in all industries and social activities and achieve both economic development, health, and solution to social problems in parallel. We hope this international webinar could share some new knowledge and information to the society, college, students, and lecturers. We hope this international webinar will run smoothly. We would like to extend a huge congratulations to everyone who participated in this webinar. We hope all of you can get many benefits from this event. We apologize for any mistake our remark might have caused. Thank you so much for your interest and attention. Wassalamualaikum warahmatullahi wabarakatuh.
Distinguished guests, ladies and gentlemen, it's an honor for us. We will have welcoming speech from the Ministry of Tourism and Creative Economy of Republic of Indonesia. Please welcome Dr. Alhaj Sandiaga Salahuddin Uno, BBA, MBA, to deliver speech in front of us. Time's yours.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera untuk kita semua. Salam dan shalom. Om Swastiastu, Namo Buddhaya, salam kebajikan, salam sehat, salam Indonesia maju, penuh semangat. Yang terhormat Rektor Universitas Aisyah Surakarta, Ibu Riani Wulandari, SCAP and SMCAP, merupakan suatu kehormatan bagi saya untuk menyampaikan pidato ini dalam webinar internasional tentang The Role of Health, Business, and Technology in a Society 5.0. Webinar ini merupakan kesempatan besar bagi kita untuk berbagi pengetahuan dan pengalaman tentang bagaimana kita dapat memanfaatkan kesehatan, bisnis, dan teknologi untuk menciptakan masyarakat yang lebih baik di era masyarakat 5.0. Kesehatan merupakan salah satu aspek terpenting dalam kehidupan manusia. Bukan hanya bebas dari penyakit, tapi juga kesejahteraan fisik, mental, dan sosial. Dalam masyarakat 5.0, kesehatan harus menjadi prioritas utama. Dan kita perlu memanfaatkan teknologi dan inovasi untuk meningkatkan kualitas layanan kesehatan dan membuatnya dapat diakses oleh semua orang. The role of health, business, and technology in the society 5.0 erat kaitannya dengan tujuan pendidikan nasional Indonesia yang bertujuan untuk mengembangkan sumber daya manusia yang mampu memberikan kontribusi terhadap pembangunan bangsa dan dunia. Konsep masyarakat 5.0 menekankan integrasi dunia fisik dan digital untuk menciptakan masyarakat yang berpusat pada manusia, berkelanjutan, dan inklusif. Saya berharap webinar ini menjadi acara yang bermanfaat dan produktif yang berkontribusi terhadap pengembangan masyarakat 5.0 dan menciptakan masa depan yang lebih baik bagi kita semua. Selamat mengikuti webinar internasional The Role of Health, Business, and Technology in the Society 5.0. Nasrun minallah wa fatun qarib wa basyiril mu'minin. Assalamualaikum warahmatullahi wabarakatuh.
The Honorable ladies and gentlemen, as one of our creative products, Aisyah University Student Creative Club will show the dance under the title of Pejuang Dance. Can we Can we give a big applause for it and enjoy? Distinguished guests, ladies and gentlemen, it's honor to me now. It's time to hand over this session to the moderator. And the moderator will be going in this session is Mr. Reza Marendra. He is one of staff of Aisyah Surakarta University who concerned in partnership and collaborating issues between health, business, and technology. Let's invite between us our moderator today. Please welcome Mr. Reza Mandera.
Assalamualaikum warahmatullahi wabarakatuh. Thank you very much to Mrs. Rosida for giving me the chance to be here, and I would like to show my gratitude to all of you, to the Mr. Minister, the Director of Aisyah University, to the speakers, and to all of the audiences. I would like to greet all of you. I would like to say selamat pagi untuk Indonesia dan Malaysia. Dobry utro dia Rusi. Subahal khair lil maghrib, and good morning to people all around the globe. Ladies and gentlemen, to give you an overview of what we'll be discussing, we'll be discovering the role of health, business, and technology in the Society 5.0. Today, we have 5 presenters, and they are from 4 different countries and 3 different continents. In this section, I would like to divide into 2 sessions. The first session will be presented by our 2 speakers, and then followed by the discussion session, and then the rest of the speaker will be on the second session. It means there are 3 speakers in the second session and followed by discussion session. To all of the audiences, we encourage you to raise up your question, share your thought, or realistic example of what we have talked today. Ladies and gentlemen, for the first session, we have 2 speakers, and the first speaker, he is a lecturer for nursing program at Aiska University. He is a member of Indonesian National Nurses Association, or as we call PPNI, since 2018. He has published 3 publications. One of them is The Effectiveness of Women Empowerment in Preventing Stunting in Children aged 6 to 59 months in 2021. He involved in a society service, management of free sex prevention by increasing students' knowledge of adolescents' reproductive health at SMAN 1 Pacitan in 2023. He was awarded as the best graduate from Master Program of Nursing at Universitas Muhammadiyah Yogyakarta in 2022. Today, he is going to share his thoughts about the role of health in the Society 5.0, Big Data, and Artificial Intelligence. Ladies and gentlemen, please join me in welcoming Mr. Didi Iman Margatot. Assalamualaikum, Mr. Didi. Hello? Hello, Mr. Didi. Can you hear my voice?
Okay, Waalaikumsalam, Mr. Reza.
How are you today, Mr. Didi?
I'm very well, sir.
It's nice you are here with us, and today you are going to share your idea about the role of health in the Society 5.0, and we are going to give you 30 minutes, and it is starting from now.
Okay, thank you, sir, for the time and room for me. Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. Before start the presentation, I will introduce myself. My name is Didik Iman Margatot. I lecture from University of Aisyah Surakarta. Alright, ladies and gentlemen, the title of the presentation that I will convey today is the role of health in 5.0 society, especially big data, artificial intelligence, and robotic in healthcare. Next slide. Alright, the learning material in my presentation. On this opportunity, I will explain about what is the meaning of 5.0 society, and the second, the importance of health in 5.0 society, and then the third, key principles of 5.0 society, technological advancement and health, and then the challenge and ethical considerations, and the last conclusion and future of health. Next slide. Okay, ladies and gentlemen, what do you think about 5.0 society? So 5.0 society is the super smart society, concept that draws no boundaries between the physical and virtual worlds, driven by advanced technologies such as artificial intelligence or AI, Internet of Things or IoT, robotics, and big data analytics. The concept aims to create a highly sophisticated and interconnected society where technology, humans, and nature coexist harmoniously. The concept of Society 5.0 is human-centered society. That is a concept that emphasizes the quality of human character, morals, and abilities and requires technology and humans to live side by side in order to improve the quality of human life in a sustainable manner. Next slide. Okay, ladies and gentlemen, this slide explains the process from 1.0 society until 5.0 society. The first 1.0 society, the hunter-gatherer society. This was the earliest form of human society, characterized by small nomadic groups of people who relied on hunting, gathering, and basic agriculture for survival. And the second of the 2.0 society. The name is the Agrarian Society. This era marked the transition to settled farming communities with the advance of agriculture and the domestication of animals. And the third is 3.0 society. The name is the Industrial Society. The Industrial Revolution brought about significant technologies advancement, leading to mass production and urbanization. People moved from rural areas to cities to work in factories. And then 4.0 society. The name is the Information Society. The proliferation of computers, the internet, and information technology defined this era. It revolutionized communication, access to knowledge, and the way business and daily life were conducted. And then the last, the name is 5.0 society. This is the super smart society. Okay, the next slide. So, this concept aims to create a highly sophisticated and interconnected society with technology humans. This is the first human-centric approach. This is putting human well-being at center. Society 5.0 aims to fulfill individual needs and empower people through technology and healthcare tailored to individual needs. And then the second point B is super smart system. This is the harnessing the power of artificial intelligence or AI, and then the Internet of Things or IoT, and automation to create highly efficient and responsive system from healthcare to transportation. And the point C, harmony with nature, promoting sustainability and environmentally friendly practice, including eco-friendly technologies and a focus on renewable energy source, sustainable healthcare practice, promote preventive care and eco-friendly medicine. And then point D, the economic models, encouraging innovation and entrepreneurship in sectors like health, biotechnology, and clean energy, which can drive economic growth and create jobs. And then the last, longevity and health, striving for extended healthy lifespans by combining advanced medical technologies with lifestyle choices that promote wellness. Next slide. So, in this era of Society 5.0, there are many advances in technology and health, such as the first, big data and artificial intelligence or AI for disease predictions, and the second is robotics in healthcare, and the last, 3D printing for personalized medical device. Next slide. So, in this slide, I want to explain about big data and artificial intelligence for disease prediction. Big data refers to a vast and complex volume of data that is too large to be effectively processed, stored, and analyzed using traditional data management tools and methods. It is characterized by the three V's: volume, velocity, and variety. Additionally, two more V's, veracity and value, are sometimes included to further describe big data. To effectively harness the power of big data, organizations often employ advanced technologies and tools, including data analytics, machine learning, artificial intelligence, and data warehousing. These technologies enable business, governments, and research institutions to extract valuable information from large datasets, leading to better informed decisions and improved understanding of various phenomena. Big data has application in various fields, including business, healthcare, finance, marketing, and scientific research, and it has the potential to drive innovation and create a competitive edge for those who can effectively manage and utilize it. Next slide. So this slide, I want to explain about artificial intelligence, or the name AI is changed our modern life, and in medicine, artificial intelligence has two main branches, virtual and physical. The physical branch includes robotics, which can assist surgery and rehabilitation, and then the virtual branch includes informatics, which is expected to assist physicians in their clinical diagnosis and treatment decisions. The recent progress of machine learning with big data analysis is contributing greatly, especially in the field of clinical imaging, pharmacokinetics, genetics, and oncology. So, next slide. Alright, this is the picture. We can see in this picture, on overview, the application of artificial intelligence in some major sector, for example, engineering, communication, healthcare, and then robotics and manufacturing, for economic and etc. So artificial intelligence and machine learning have important application in healthcare and precision oncology. Machine learning is a subset of artificial intelligence that use neural networks to solve healthcare problems and predict treatment outcomes by pattern recognition in patient datasets. The accuracy of the data is warranted by implementing deep learning of machines. Next slide. So, this is the NE2 journal about artificial intelligence. So, this is some journal. Can you read for reference about big data and artificial intelligence? This journal is about artificial intelligence predict the progresses of diabetic kidney disease using big data machine learning. In this journal, explain about constructed a new predictive model for diabetic kidney disease using artificial intelligence, processing natural language and longitudinal data with big data machine learning. Based on the electronic medical records, EMR, of 64,059 diabetes patients, artificial intelligence extracted raw features from the previous 6 months as the reference period and selected 24 factors to find time series patterns relating to 6-month diabetic kidney disease aggravation. Using a convolutional autoencoder, artificial intelligence constructs the predictive model with features and then including time series data using logistic regression analysis. Artificial intelligence could predict diabetic kidney disease aggravation with 71% accuracy. The new predictive model by artificial intelligence could detect progressions of diabetic kidney disease and may contribute to more effective and accurate intervention to reduce hemodialysis. Okay, right, next slide. So I will to explain about robotics in healthcare. In healthcare, the term robotics refers to the use of robotic system or machine to perform various tasks, procedures, or assistive function in medical and healthcare settings. These robots are specially designed and programmed to work alongside healthcare professionals, enhancing patient care, improving efficiency, and even tackling tasks that might be too risky or repetitive for humans. Robotic technology in healthcare encompasses a wide range of applications, including surgery, patient care, rehabilitation, diagnostic, and the last logistics. Advancement in robotic technology triggered its usability in the next generation healthcare system. Healthcare robots are expected to assist clinicians and healthcare professionals at all settings by monitoring patients' physiological condition in real time, facilitating advanced intervention such as robotic surgery, supporting patients, and at the hospital and home, and then dispensing medication, assisting patients with cognition challenge and disabilities, and then keeping company to geriatric and physically mentally challenged patients and hospital building management, such as disinfecting place. So the robotic agent can enhance healthcare experience by reducing patient care work and strenuous repetitive manual tasks. The robotic application can also be eliminated in supporting the healthcare system for the management of pandemics like novel coronavirus or COVID-19 infection and upcoming pandemics. Such applications include collecting the sample from a patient for screening, disinfecting the hospital, supply logistics, and food to the infected patient, collect physiological and condition. Next slide. So, in this picture, the types of robots are preferably used at a hospital reception to disseminate information about various units or sections of the hospital and guide patients visitors as shown in this picture. They can handle a number of visitors without becoming tired and direct them to the physician of their choice. They also are attractive to children coming to the hospital and amaze them by inducing pleasurable experience and hence reducing their malaise systems. And then the next slide. So in this slide, the picture of the robots are meant to assist doctors in the hospital in the same manner as that of human nurse. Nurse robots are commonly used in Japanese hospital as Japan has the highest percentage of elderly above 75 years. Individuals among Organization for Economic Cooperation and Development countries. This process of growing challenge for the medical facilities in the country. Without sufficient recruitment for elderly care, more Japanese citizens are socially bound in taking care of aging family members at home instead of doing a job. In addition, the nursing and healthcare individuals undergo high stress and exhaustion due to patient load. Therefore, the Japanese government is looking towards technological solution to take care of aged patients in the country. Next slide. As per statistics, around 800,000 people per year suffer from cardiac arrest in the European Union, out of which only 8% survive this emergency. So in this picture, the name robot is ambulance robot or ambubot. The main cause of this large number of victims is due to the comparatively sluggish response time of emergency service, typically 10 minutes, whereas brainstorm that comes in just 4 until 6 minutes after severe cardiac arrest. The immediate medical aid after an accident is critical in order to prevent intensification of trauma. Thus, by speeding up emergency response, more lives can be saved as a result of fast recovery. This is particularly factual for drowning, cardiac failure, shocks, and respiratory problems. Life-saving strategies such as emergency medication, cardiopulmonary resuscitation or CPR, and automated external defibrillator or AED, as can be designed lightweight and compact enough to be transported by a flying drone to the emergency site. Such robots are useful in providing emergency treatment with minimum response time to a mobile or distant patient, as shown in this picture. A lightweight miniature pilot is developed for the ambulance drone, containing essential medical supplies for life support. Next slide. So, in this slide, I want to explain about challenge and ethical considerations. The first challenge, data privacy and security. Data privacy and security in Society 5.0 are of paramount importance due to the increased integration of advanced technologies, especially artificial intelligence or AI, and then the Internet of Things or IoT, and the last big data analytics. As Society 5.0 envisions a highly connected and data-driven world, ensuring the protection of sensitive information and the security of data is crucial. And the second, individual empowerment. In Society 5.0, individuals are empowered by technologies that allow them to access and control their own data. This shift thoughts of human centricity means that people have more say in how their data is collected and used. Data ownership. The data ownership is individuals own their personal data. They can grant or restrict access to it, and they have the right to know who is using their data and for what purpose. And the third, consent and transparency. Organizations must obtain informed and explicit consent from individuals before collecting and using their data. Transparency in data practice is essential, and people should know what data is being collected, for what purpose, and how it will be used. And then the data minimization. The data collection is limited to what is necessary for the intended purpose. Unnecessary data is not collected or retained. And then the last, the data portability. The data portability is individuals have the right to move their data from one service or platform to another, promoting competition and choice in the digital ecosystem. And then the healthcare inequality. This challenge healthcare inequality in 5.0 society refers to the disparities in access to and the quality of healthcare service in a society that has embraced advanced technology, data-driven healthcare, and innovative medical solutions, while Society 5.0 envisions a highly connected and technologically advanced society. It also raised concern about the potential exacerbation of healthcare inequalities. And then ethical use of artificial intelligence and genetics. Transparency is critical in the use of artificial intelligence. People should be aware when they are interacting with artificial intelligence systems, and they should understand how decisions are made. This transparency extends to explaining how artificial intelligence-driven recommendations, such as those in healthcare diagnosis or financial decisions, and then reach. And then privacy practices in 5.0 society involves the collection and analysis of vast amounts of data, including personal and health-related information. Ethical consideration revolve around protecting individual privacy and ensuring that data is used only for its intended purpose. Clear data ownership and consent mechanisms are essential. And then robust ethical framework. Organization and government must develop and adhere to ethical framework for artificial intelligence development and deployment. This framework should align with principles of safety, fairness, and transparency. And then technological unemployment. Technological unemployment in 5.0 society refers to the phenomenon where advance in technology, particularly artificial intelligence or AI, automation, and robotics leads to a significant reduction in the demand for human labor across various industries and job roles. In 5.0 society envisions a highly technologically integrated society, and while it offers numerous benefits, it also raises concern about the impact of automation and artificial intelligence on employment. And then the last is environmental impact. In 5.0 society, there is a heightened focus on environmental impact and sustainability as part of the broader visions for a harmonious and technologically advanced society. This concept recognizes the interdependence of human progress and the environment. Clean energy. In 5.0 society promotes the use of clean and renewable energy sources, such as solar, wind, and hydroelectric power. The transition to low carbon and green energy is essential to reduce greenhouse gas emissions and combat climate change. So the next slide. Next slide, please. So the conclusion, in 5.0 society, we are required to coexist with technology. With the advancement of technology, of course, there are many positive benefits, especially in healthcare. The utilization of big data, artificial intelligence, and robotic healthcare will certainly help medical personnel in providing care to patients. I hope that Indonesian young people can create useful technology to provide healthcare to patients. Okay, I think that's enough for my explanation. Please apologize if there are any mistakes in delivering the material. I say thank you and Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much, Mr. Didi, for your explanation, and it is very interesting. As you share your thought about the society 5.0 and then the advancement of technology from time to time, and then you also share about the challenges, the key feature, and also the goals of the society 5.0. Mr. Didi, I hope you can stay because after this, we are going to continue with the second speaker, and then I'm going to open the discussion session, and you can ask some the question. And so all the participants, I encourage you to prepare the question, for our first speaker and the second one, and then I'm going to read your question in the discussion session. Ladies and gentlemen, let's move on to the second speaker, shall we? She is lecturer of midwifery program at Aiska University. She was majoring Master of Science in Nurse and Midwifery at National Taipei University of Nursing and Health Sciences, Taiwan. She is expert at postpartum, exclusive breastfeeding, pregnancy, women and child health, and labor. She has several publications, including Maternal Challenges of Exclusive Breastfeeding, Determinant of Breast Problem. Up to date, she is an author for 8 books. She was awardee of NTUNH scholarship. Today, she is going to share her thoughts about Indonesia's strategies for combating stunting in the 5.0 era. Ladies and gentlemen, without any further ado, let's welcome Mrs. Siska Ningtyas Prabasari. Assalamualaikum, Mrs. Siska.
Waalaikumsalam, Pak Reza.
Okay, how are you today?
I'm fine. Thank you.
Are you ready to deliver your material?
Inshallah.
Okay, ladies and gentlemen, so we are going to give the floor to Mrs. Siska, and your time is 30 minutes starting from now.
Okay, thank you. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Okay, ladies and gentlemen, in this presentation, I would like to present about the Internet of Things for stunting in 5.0 society. Okay, so as we know that stunting is one of the most pressing issues facing Indonesians today. In this good occasion, we will explore about stunting and the Internet of Things which used for combating stunting in 5.0 society. Okay, next. So the objectives of our presentation today are an overview of stunting in Indonesia, then the causes of stunting in Indonesia, impact of stunting on health and development, so current efforts to address stunting, challenges in stunting prevention and treatment, and then the way forward, future directions, and also opportunities, and the Internet of Things, WHO control for stunting. Okay, next. So, an overview of stunting in Indonesia. We know that stunting is a form of malnutrition that occurs during a child's first 1,000 days of life. And it happens when a child is not able to get the necessary nutrition for growth and also development. Stunned children are too short for their age and often have cognitive and developmental delays, and usually it caused by inadequate nutrition or repeated infections. So what are the consequences? Stunting has long-term effects on individuals, communities, countries, including lower productivity and increased healthcare costs. It also affects ranging from poor cognitive development to chronic disease in adulthood. And how bad is the problem in Indonesia? Indonesia has one of the highest rates of stunting in the world, with 27.7% of children under the age of 5 affected in 2020. So the effort to decrease stunting rates in Indonesia have shown positive results, but there's still so much work to be done. Stunting rates in Indonesia have decreased in recent years, but are still alarmingly high. According to UNICEF, as 2022, approximately 27% of Indonesian children under the age of 5 suffer from stunting. So there are some factors contribute to stunting. Stunting is a complex with multiple causes, including poverty, inadequate maternal and child nutrition, and then poor sanitation and also lack access to the healthcare. So next, please. There are some causes of stunting in Indonesia. The first one is poverty. Okay, ladies and gentlemen, we know that the low-income families often cannot afford nutrition, food, or proper health care. And then socioeconomic disparities and also limited resources disproportionately affect certain communities, contributing to stunting among the children. Also, inadequate maternal and also child nutrition. Some mothers and young children are often undernourished, which can have lasting consequences on their health. Poor nutrition and lack of access to a balanced diet contribute to stunting among children in Indonesia. And then there are poor sanitations. Okay, ladies and gentlemen, we know that many Indonesia lack access to clean water and also proper sanitation facilities, which can lead to illness and malnutrition. Poor water and sanitation infrastructure can lead to the frequent infections and also illness that contribute to stunting. Inadequate sanitation facilities and poor hygiene practices increase the risk of stunting, affecting the overall well-being of the children. And then lack of access to healthcare. So medical services are often unaffordable or located far away from rural communities, and leaving people unable to access essential care. And many Indonesians lack access to diverse and nutritious food options, particularly in rural areas. And then inadequate healthcare services and immunization coverage also contribute to the prevalence of the stunting. Okay. Next is the impact of the stunting. So impact of stunting on health and development, there are some impacts. The first one is cognitive delays. So stunting can lead to the cognitive delays that can persist into adulthood and resulting in lower academic achievement and also employment prospects. We know that stunt children face barriers in accessing quality education, limiting their prospect for future productivity and also economic growth. And then is physical health issues. Stunt children are more likely to have weak immune system, making them more vulnerable to infections. Stunting has several implications for the cognitive and also physical development of the children, and then hampering their potential for growth and also education. And then economic productivity. So stunt individuals have lower earning potential, which can contribute to the intergenerational poverty and inequality. And then the economic burden of stunting is significant, affecting not only individuals, but also the overall productivity and also progress the nation. Okay, the current effort to address stunting. Next, please. There are some current efforts to address stunting which already implemented by the government. The first one is nutrition interventions. So programs provide mother and also children with the nutrition-rich food and supplements, as well as the education on health eating. So the second one is behavior change by improving sanitation. So initiative aims to increase access to clean water and also build basic sanitation facilities and improve hygiene practices in communities. And then behavior change campaign and also educational initiatives can also help promote healthy behaviors and also practices that can prevent stunting. And then we can also strengthening healthcare systems. The effort to improve medical services, train healthcare workers, and also increase access to basic health service, increasing access to preventive health services for mothers and also children. Also, it can help reduce stunting rates. And then the last one is improving agriculture. So the effort to increase sustainable agriculture and improve crop diversity can help increase access to nutritious food. And then the next. So there are some challenges in stunting prevention and treatment. First is access to remote communities. So many communities lack of infrastructure, making it difficult to provide healthcare and also nutrition interventions. And then budget constraints, insufficient funding for nutrition programs and healthcare services make it challenging to address the scale of the problem effectively. And then cultural beliefs and also practices. So socio-cultural norms and also beliefs about food and child rearing practices also can make it difficult to implement successful interventions. So the next is limited awareness and understanding of stunting. So addressing the lack of awareness and understanding of stunting is crucial to mobilizing effective effort to combat this issue and inequality and regional disparities. So reducing stunting rates requires targeted intervention to address the socioeconomic disparities and regional inequalities within Indonesia. And the third is integration of effort across sectors. So a collaborative approach integrating effort from various sectors is essential to achieve meaningful progress in reducing stunting rates. And then monitoring and evaluation. So this one is very essential because establishing robust monitoring and evaluation systems, it can enable tracking progress and identifying areas that require additional attention. The next was future direction and opportunities. So there are some opportunities or future direction that we can do. The first one is promote breastfeeding. So as we know that breastfeeding from an early age can have long-lasting positive impacts on child health and also development. And the implementation of targeted nutritional interventions and also promotion of breastfeeding support the healthy growth and also development of the children. So the second one is engage community. So by involving community members, program can tailor intervention to local context and also increase participation in stunting prevention effort. And then invest in healthcare workplace. So improving quality of care and training healthcare workers can help to ensure that children receive proper treatment, also nutrition intervention. And then strengthen nutrition program. So integrating nutrition into existing healthcare system can increase impact and effectiveness. Then, next please. So, the way forward, future direction and opportunities, the next is invest in early childhood. So, early intervention aimed at nutrition and development can have a long-lasting positive effect on children's health and well-being. And then embrace innovative solutions. So new technologies such as a data-driven approach and mobile healthcare hold promise for addressing stunting in an effective and scalable manner. And then strengthen policy commitments. Ladies and gentlemen, we know that the stronger political will and financing commitments can help to create and coordinated an effective response for the stunting crisis. And investing in research and also innovative approach. So by conducting research, can use gas distribution map stunting and its risk factors for prioritized treatment intervention. Areas with the risk factor far from the healthcare service center has rural area status located in medium to high plains and has insufficient latrine coverage. So in this occasion, I would like to inform you about the WHO Andro. So WHO Andro is a software program developed by the World Health Organization to collect, analyze, and interpret anthropometric data. So this data is crucial for monitoring child growth and also development, assessing nutritional status, and then supporting public health training, and it provides a standardized method for measuring and also interpreting anthropometric data, such as height, weight, and also body mass index or BMI, to identify growth deficiencies and also nutritional disorders. Okay, ladies and gentlemen, in Indonesia, the implementation of WHO Anthro serves multiple purposes. First and foremost, it helps to monitor the growth and nutritional status of the children and adolescents across the country. And this data is essential in planning and evaluating nutrition programs and policies that aim to improve child health and also well-being. Okay, the next, where we use the anthropometric methods, so it can be used as evidence-based health interventions. Anthropometric data is critical for designing effective health intervention for children and also population affected by the malnutrition or other health issues. And then as a public health training, So anthropometric data is often used to identify and predict health trends and patterns in a population and inform public health policies and also program accordingly. Then the importance of standardizing measurement. So the cultural differences and variation in measurement techniques can lead to inaccurate data that compromises public health interventions. So standardized measurement techniques and ensure that the data collected is reliable and also comparable across population. Then the anthropometric data collection. So there are three kind of the anthropometric data collection. The first one is the methodology for data collection. So WHO Anthro provides detailed instructions on collecting accurate measurement, including age, weight, head circumference, and other metrics. And then standardization of measurement. So WHO Anthro ensures that the measurement collected follow a standardized approach to allow for comparability across population. And the third is accuracy and reliability. So WHO Anthro offer tools and best practices for improving accuracy and also reliability and of anthropometric data, including source of error and how to avoid them. Then interpreting anthropometric data. There are assessment and also application. For the assessment, broad assessment and reference standards. So measurement deficiencies can be used to diagnose various conditions, monitor growth, and evaluate treatment progress. And the analysis of individual measurements, the metric can help track individual health changes and identify risk factors of nutrition deficiency or other health problems. And the population trends and patterns, anthropometric data is an essential tool for quantifying and analyzing the prevalence of malnutrition in a population and assessing public health policies accordingly. So the application of WHO Anthro, monitoring children growth and development. WHO Anthro can be used to track individual growth and diagnose nutritional deficiency or other issues. And then anthropometric data also assessing nutritional status and intervention is essential for evaluating the effectiveness of nutrition intervention and identifying population that might benefit from these programs. And then supporting public health training. So WHO Anthro is a powerful tool for informing public health policies and also programs and monitoring the prevalence of malnutrition and other health issues within a population. So, despite the importance and benefits of WHO Anthro, its implementation in Indonesia has faced several challenges and also there are some limitations. The first one is source of error in data collection. So, error in positioning, calibration, and timing can all affect the accuracy of anthropometric data, making this an important consideration for any data collection effort. And then cultural and contextual consideration. So cultural variations can affect the way that measurements are taken and interpreted, requiring a nuanced approach to data collection and also analysis. And then addressing data gaps and variability. So there is often a lack of data on certain population or geographic regions, and it's requiring additional investment in data collection effort and to ensure that data gaps are filled and data is complete. And then the conclusion. So there are some conclusion. The first one is importance of WHO Anthro for global health. So this application is critical tools for monitoring child health, assessing nutritional status, and informing public health policies and also program worldwide. And then continued development and improvement of the software. So WHO Anthro is continually refined and updated to ensure that it meets the needs of researchers, public health workers, and also other stakeholders worldwide. And then encouragement for global adoption and utilization. So given the importance of anthropometric data for global health, we encourage its widespread adoption and use by researchers and public health workers and also policymakers globally. So Indonesia aims to reduce stunting rates to less than 20% by 2024. Achieving this goal will require continued effort and investment in nutrition, health, and sanitation infrastructure. So by working together, we can ensure all Indonesian children have a healthy start in life. So a beautiful tomorrow starts from now. The quality of human resources start from the nutritional intake at home. So let's fulfill children's nutritional intake to avoid stunting. Thank you for your attention. Assalamualaikum warahmatullahi wabarakatuh.
Indonesia's strategy for combating stunting in 5.0 era. You also bring your thoughts about stunting, how to prevent it, and something that is important and interesting, that is you introduce to us the new application that is WHO Intro. It is something new for me. Ladies and gentlemen, I would like to invite you to share your thoughts, your idea, your question, a realistic example of what we have talked from our first session, which is the role of health in the society 5.0, and also Indonesia's strategies for combating stunting in the 5.0 era. Now, I would like to open the floor for the question session. Okay, we have collected all of the questions, and we also have sorted the questions based on the speaker. I would like to offer Mrs. Siska the question. There are several questions for you. The first one is, as a student, what are the steps that we can do in effort to reduce stunting rate? That's the first question. And then the second question, what are the challenges faced in implementing WHO Intro in Indonesia and how to overcome these challenges? And then the last question, what are the roles of education in promoting healthy lifestyle for reducing stunting rate? So the first session will be answered by Mrs. Siska, and then after that, it will be followed by the question for Mr. Didi. Okay, Mrs. Siska, please answer this question.
Okay, thank you, Mr. Reza. Okay, the question is about the role for a student, right? So as a student, there are some steps that we can do in effort to reduce stunting rates. Maybe the first one, we can developing a collaboration network within universities located in Indonesia. So we can make collaboration and then mapping potential universities and study programs in implementing the student programs. So this is important both through regular community service programs and also through the MBKM mechanism. And then we can also do profession for students and also supervisors regarding mentoring material target groups at the risk of the stunting. And we can also assistance by students through education to target groups at the risk of stunting direct as well as collaborative assistance. And we can also analysis and identification of problems and potential resources at the target locus mentoring as material for planning action for handling problem. So, and last, we can also preparation of recommendation of and in publication as well as stakeholders in related area. So these are the steps that student can do in combating or in addressing stunting in Indonesia, especially. Okay, for the second question. So the challenges, right, Mr. Reza?
Yes, the challenges.
Okay, the challenges that we face in implementing WHO Intro in Indonesia and how the solution or how to overcome these challenges. So we know that despite the importance and benefits of WHO Intro, The implementation in Indonesia has faced several challenges. These include limited resources and funding, language barriers, and then the logistical complexities or gathering accurate and representative data from a vast and diverse population. So the implementing WHO Antro in Indonesia has been crucial in improving the monitoring and assessment of the nutritional status of children. The challenges faced were overcome by the commitment. So the solution is the commitment of the healthcare professionals and also policymakers. And some steps which be implemented are training and also training and capacity building and for the healthcare professional and also field staff and how to collect the accurate anthropometric measurement and also use the WHO Antro software effectively. That's the challenge and also the solution that we can do for implementing the WHO Antro in Indonesia. And then the last questions about the rule of education, right, Mister?
Yeah, rules of education, as you are a lecturer, so I think it is your affair to talk about that.
Okay, so in the academic or the rule of education, we can maybe also build a school curriculum. So integrating nutrition education into school curriculums can raise awareness and also empower young people to make healthier choices. And then maybe we can also educational campaign. So launching awareness campaign that focus on the importance of nutrition and also physical activity helps to instill healthy habits from a young age. Addressing stunting in the young generation requires a multi-sectoral approach, of course, by involving governments, policymakers, educators, and also healthcare providers, and also communities. So prioritizing nutrition, healthcare, and also education can help break the cycle of stunting and pave the way for healthier and also more prosperous futures of the youth. So maybe that's all the things that we can do as a education. I mean that the rules of education in promoting healthy lifestyle for reducing stunting rates. The first one, school curriculum, and the second one is the educational campaigns. Thank you.
Okay, thank you very much, Mrs. Ka, for answering those questions. I hope the answer from Mrs. Ka can fulfill your curiosity. And then there are two questions that are addressed to our first speaker, who is Mr. Didi. The first question is, how can nurses prepare for the integration of artificial intelligence into their practice? And then the second question, what are the advantages of using robots in nursing and healthcare? Mr. Didi, so it's time for you to answer this question.
Right, thanks, sir, for the question. Next question. The first question is, how can nurses prepare for the integration of artificial intelligence into their practice, right?
Yeah.
So, the answer is the nurse can prepare for artificial intelligence into integration by staying informed about artificial intelligence developments in healthcare, participating in relevant training and education, and being open to using artificial intelligence tools as valuable as in their daily work. Collaboration with technology experts and IT teams is also crucial, and in the education and training, the first stay informed, not so stay updated on the latest developments in artificial intelligence and its application in healthcare. This can involve reading research articles, attending conference, and following introduced industry news. And then the second, formal education. Consider taking courses or pursuing advanced degrees related to healthcare informatics or artificial intelligence in healthcare. Many universities now offer programs specially designed to educate healthcare professionals about artificial intelligence, develop digital literacy. The first, familiarize yourself with digital tools and technologies commonly used in healthcare settings, such as electronic health records or EHR, and data analytics platforms. And the second, learn to navigate and utilize artificial intelligence powers, software, and device relevant to nursing such as artificial intelligence-based diagnostic tools or monitoring equipment. So, for the last question, right?
Yes.
About okay. So the last question is, what are the advantages of using robot in nursing and healthcare? Right, sir?
Yeah, that's correct.
Yes. So the use of robots in nursing and healthcare offers several advantages, contributing to improved patient care, efficiency, and overall healthcare outcomes. Some of the key benefits include reducing the burden of repetitive tasks. Robots can take on routine, repetitive tasks such as medication delivery, data entry, and transportation of supplies. This frees up healthcare professionals, including nurses, to focus on more complex and value-added activities like patient care and critical decision making. And then the second, improve patient safety. Robots can assist in medication and administration and patient monitoring, reducing the risk of medication errors and providing continuous, consistent care. Additionally, they can be used in environments where infectious diseases are present, minimizing the risk of healthcare associated infections. And then precision and consistency. Robots are highly precise and consistent in their actions, which can be particularly beneficial in surgical procedures where accuracy is critical. Robotic assisted surgery, for example, allow for finer control and reduced tremors. And then the last, enhancing telemedicine. Telemedicine robots equipped with cameras and sensors can help extend healthcare to remote or underserved areas, allowing healthcare providers to remotely examine and communicate with patients. This is especially valuable during public health emergencies or for patients with limited access to healthcare facilities. So I think that's the answer for our question. Thanks for your attention.
Okay, thank you very much, Mr. Didi, for answering our question. That's very interesting. Can we give applause to Mr. Didi and Mrs. Siska for delivering the message? Thank you very much, ladies and gentlemen. Before we move on to the second session, we would like to present a break for a while. Please enjoy.
The city of Surakarta, better known as the city of Solo, is famous for its slogan, the spirit of Java, which means the soul of Java, a city that attaches its image as the center of Javanese culture, people who maintain local wisdom with global thinking. Aisyah Surakarta University is present as one of the universities in the city of Surakarta, which adds to the charm of the world of education in Nusantara. The University of Aisyah Surakarta has gone through a long historical process of civilization in transforming forms. Founded in 1966, starting from the Aisyah University Midford School, then in 1981, became the Aisyah Surakarta School of Nurse. In 1997, became Midferry Academy Aisyah Surakarta. In 2002, established the Aisyah Surakarta Nursing Academy. In 2005, the College of Nursing was established Health Science, Aisyah Surakarta, and in 2020 has been transferred into Aisyah Surakarta University. Currently, Aisyah Surakarta University comes with 3 choice of faculties and 11 study programs. Faculty of Business and Economics with study program, Bachelor of Entrepreneurship, Excellent in business innovation skill and creativity based on digital. Bachelor of Retail Management. Excellence in technology-based retail management. Faculty of Science and Technology with undergraduate program in Information System and Technology. Excellent in System Service and Information Technology with the integration of artificial intelligence. Faculty of Health Science with study program. Bachelor of Hospital Administration. Excellence in Digital-based Hospital Administration. Bachelor of Midwifery. Excellence in Tibun Nabawi. Diploma for Physiotherapy. Excellence in Geriatric Physiotherapy. Diploma 3 Nursing. Excellence in Wound Care. Bachelor of Nursing. Excellent in Disaster Management. In addition, the University of Asia Surakarta has nurse provision, midwife provision, and midwifery transitional programs. Educational activities at the University of Asia Surakarta are supported by sophisticated and modern facilities, equipped with a studio, smart classroom, discussion corner, digital library, mini hospital, Asia Pratama Clinic, and various laboratories that make learning activities possible anytime and anywhere. Asia Surakarta University also prioritizes Islamic values in the learning process to produce graduates who excel intellectually, socially, and spiritually. There are Islam and Muhammadiyah program. Asia University of Surakarta is meant to deepen religious knowledge for students. University Asia Surakarta provide one-day service, a service that makes it easy for you to become a student of Asia Surakarta University. Asia Surakarta University provide opportunities to excel and win scholarship. Scholarships are obtained from Asia Surakarta University, Nazismu, government partner of Asia Surakarta.
Just one more step. You can get all these conveniences by registering yourself through this link. Asia Surakarta University, leading in character qualities.
Let's join with us at Surakarta Asia University, leading in character qualities.
The first speaker, he is a lecturer for School of Physiotherapy, Faculty of Health Sciences, Nursing and Education of Masa, University, Malaysia. He was a physiotherapist for Badminton Association of Malaysia from February 2020 to February 2021 in collaboration with SOSRAC. He is a member of Malaysian Physiotherapy Association or MPA. He involves in 4 clinical experiences. One of them is general clinical posting in Hospital Sultan Haji Ahmad Shah, Temerloh, Pahang, Malaysia, covering all areas of study in physiotherapy course including musculoskeletal, cardiorespiratory, neurology, and specialized program from February to March 2018. He listed his name on 10 achievements. He achieved Best Paper Presentation Award, Masa International Conference in Health Science and Technology in 2022. Today, he is going to share his idea, his thought about the development of physiotherapy for society 5.0 in Malaysia. Ladies and gentlemen, please join me in welcoming Mr. Muhammad Al-Kautsar bin Harun. Assalamualaikum, Mr. Muhammad Al-Kautsar. Can you hear my voice? Mr. Kautsar, are you with me?
Hello? Hello, can you hear me? Hello?
I'm going to give you 30 minutes to deliver material.
Sorry.
Please take your time, Mr. Al-Kautsar.
Can you hear me? Cannot. Sorry. Give me for a while.
Okay.
The city of Surakarta, better known as the city of Solo, is famous for its slogan, the spirit of Java, which means the soul of Java, a city that addresses its image as a center of Japanese culture, people who maintain local wisdom with global thinking. Aisyah Surakarta University is present as one of the universities in the city of Surakarta, which adds to the charm of the world of education in Nusantara. The University of Aisyah Surakarta has gone through a long historical process of civilization in transforming forms. Founded in 1966, starting from the Aisyah University with first school, then in 1981, became the Aisyah Surakarta School of Health Nurse. In 1997, became Mid-Ferry Academy Aisyah Surakarta. In 2002, established the Aisyah Surakarta Nursing Academy. In 2005, the College of Nursing was established Health Science, Aisyah Surakarta, and in 2020 has been transferred into Aisyah Surakarta University. Currently, Aisyah Surakarta University comes with 3 choice of faculties and 11 study programs. Faculty of Business and Economy with study program, Bachelor of Entrepreneurship, excellent in business innovation skill and creativity based on digital, Bachelor of Retail Management, excellence in technology-based retail management, Faculty of Science and Technology, with undergraduate program in Information System and Technology, excellent in System Service and Information Technology, with the integration of artificial intelligence, Faculty of Health Science with study program, Bachelor of Hospital Administration. Excellence in Digital-Based Hospital Administration. Bachelor of Midwifery. Excellence in Tibun Nabawi. Diploma for Physiotherapy. Excellence in Geriatric Physiotherapy. Diploma 3 Nursing. Excellence in Wound Care. Bachelor of Nursing. Excellent in Disaster Management. In addition, the University of Aisyah Surakarta has nurse provision, midwife provision, and midwifery transitional programs. Educational activities at the University of Aisyah Surakarta are supported by sophisticated and modern facilities, equipped with a studio, smart classroom.
Hello, good afternoon. Hello, good morning. Assalamualaikum.
Waalaikumsalam warahmatullahi wabarakatuh.
Ya. Sorry. Just now we got saya ada issue dengan earphone saya. Got issue with my sound. Yeah.
Okay, no big deal, Mr. Kausar. We are happy you are here. So,
Yeah.
we are going to give you 30 minutes and it's starting from now. Is that okay?
Yeah. Okay. So first, I will share my screen, right?
Will you share your own screen or we will share your screen?
Both can. Okay. So I start first. Okay. Good morning and Assalamualaikum. So my name Muhammad Al-Kausar bin Harun. So I'm a lecturer from School of Physiotherapy Masa University. Can move to the next slide. Okay, so here are my content. So first, because we want to talk about development of physiotherapy in our country, Malaysia, and is it like is in accordance with our technology right now or AI? So first of all, we have to check about what is Society 5.0. So easy to say why we need to know about Society 5.0 because we need to see is it important for this society to be in accordance with physiotherapy field. Okay, so next my content is I will talk about physiotherapy. So because we want to see is there any relationship or association with between physiotherapy and Society 5.0. So we need to understand what is physiotherapy. Then right now we want to see what is the importance of technology in the physiotherapy field. Then you want to see is it physiotherapy field development in Malaysia, in our country. Then we want to see about is it this technology and AI in accordance with the technology right now. Then want to see is it future of technology in physiotherapy field, and lastly will be my reference. Okay, can go to the next slide. So what is physiotherapy 5.0? Okay, next. So basically physiotherapy Society 5.0 is the technology focused society. So Society 5.0, a proposed next evolution of our society, is one where human challenges are solved by incorporating the innovation of the fourth industrial revolution, such as the Internet of Things, big data, robotic, and artificial intelligence (AI) into every aspect of industry and social life. So easy to say different with previous society. So Society 5.0 is the society that totally we focus on technology. So we start living manual things, then we start using technology based. So we focus on technology. Okay, next. So right now I want to see what is physiotherapy because we know already what is Society 5.0. So we want to see what is physiotherapy. Okay, next. So physical therapy is the field of healthcare focused on restoring physical function, mobility, and motor skill in people with all types of medical condition, whether patients are recovering from a sport injury, a stroke, or major surgery. Physical therapy is essential for managing pain, rebuilding independence, and maximizing overall quality of life. So I believe we familiarize what is physiotherapy, right? So we're dealing with people that have issue with their condition. For example, we have injuries to brain or spinal cord. All these can affect our movement. Even we have accident, for example, then we got injury to maybe fracture or those things. So this thing can affect our movement. So our function as physiotherapy, we will restore the patient or the person to optimum function. Okay, next. So why physiotherapy assessment and treatment need to be in accordance with technology? So easy to say physiotherapy more on manual technique or those things. But right now with developing technologies, so we want to see, is it important for us to in accordance with technology? Okay, next. So technology used in physical therapy clinic can significantly improve their quality of life. Why? Because when we use technology, we can reduce human error, because we as a human, we tend to do error. So with technology, we can reduce the error. So next is technology is making physical therapy more accessible and effective for patients all over the world, because physical therapy deals primarily with movement. It's a very hands-on type healthcare. Technology in physical therapy is becoming increasingly widespread because it enables PT provider to deliver more precise and effective treatment to more people. Why? Because first thing is we can reduce the gap between distance. For example, we can use tele-rehab. Tele-rehab can reduce the time, reduce the cost in terms of traveling of patients, all those things. Technology significantly increase efficiency in the clinic, enabling them to treat more patients while maintaining a high standard of care. Okay, next. So, physical therapy technology lead to better outcome for patient, as physical therapy are able to gather objective data about each patient progress and alter treatment program as necessary. So easy to say, because we as physio, we need to check when we do objective assessment, we need to check very details. So when we use technology, we can reduce the risk of error, like the same point that I told before. So that's why it's important for us to adopt or adapt with technology in physical therapy right now. It can keep physical therapy patient more engaged in their treatments, especially when using virtual reality and AR, augmented reality. Ongoing improvement in adaptive equipment have also allowed many people with disability to regain a level of independency previously thought impossible. Why? Because when there is a virtual reality, the patient can be more more interested to do, rather than face to face with the therapist only. When the patient see the virtual reality, they feel more excited, so they want to engage more. So when the patient engage more, it will lead to better outcome in terms of the result of the treatment. So people can get the care they need without spending lot of time and resource traveling to see a specialist. They are more likely to address their health issue. Okay, next. Development of physiotherapy technology in Malaysia. So right now we want to see, is it our country, Malaysia, is it we adapt or in accordance with that technology right now? Okay, next. So in our country, actually we start doing robotic rehab already, but it's not much. But we start integrating robotic rehab in our facilities, mostly for neuro type of patient. So while physical therapy will always require human touch, robotic are helping clinic become more efficient. Patient become more independent. In some clinic, robots assist patient with dynamic strength and mobility exercise. In others, robotic exoskeleton help patients relearn how to walk or practice their balance in unpredictable environment without risk of falling. So easy to say, when we use robot, actually quite the same point that I said before. We want to reduce human error because sometimes we got tired. When we got tired, we tend to do mistake. So when we use robot, we can reduce the mistake and we get a better outcome in terms of the result from the treatment. So all these devices enable huge leap in the quality of life for people with long-term disability. Robot-assisted prosthetic help people with limited strength or motor skill perform a variety of daily tasks and activity. In certain patients with missing limb or extremity, robotic device can even help restore sensory feedback. So, for years, most robotic assisted devices have been controlled with switches and buttons, or by moving other parts of the body. However, recent research in mind-controlled robotic processing have shown significant promise. While we are still in ways from the cybernetic limb, you see in science fiction movies, it's exciting to think about what the near future holds for robot in physical therapy. Because right now, we will see sometimes robot also can time consuming, easy to say, then monies need to spend a lot, but we will see in the near future when we see the effectiveness of using robot, then we see is the value is we cannot get from others. We can get more when we use robot. Okay, next. So one example of the robotic rehab that been used in our country is Cyberdyne. So it's the location at Soso Rehabilitation Malacca. So this Cyberdyne Hall robot suit are designed to detect this weak bioelectric signal through the electrode or detectors. They attach to the surface of the leg muscle and analyze the signal through the control system on the robot. So this just as mentioned about this Cyberdyne. So they're coming from Japan. Then they're starting to offer their robot to our country. So this means that even though the leg muscle cannot respond to the brain signal to walk, the robot suit can accelerate the learning process of the brain and muscle to promote leg movement again. So by consolidating various information, this hall recognize the range of motion the wearer intend and assist the wearer intend motion by exerting higher power than he or she ordinarily. As it same like when we as physio we do assisted movement. So this robot will do the same thing. The thing is the advanced setting that happen in this Cyberdyne, they can measure what the expected movement available. If compared to human being, we just assist. We assist, but we don't know what's the possible range of motion that the patient able to reach. So with this Cyberdyne machine, this Cyberdyne robot, we can they can detect in which until what range the patient able to do. Then we can set, then we can get the target. For example, this week, how many ROM, how many range of motion available, then we can add more. Compared to human, sometimes we don't know how to target. Okay, next. So here's some of the example. I put a picture at Soso Rehabilitation Malacca. So you can see there, we call it, this one is exoskeleton. So this one will help the patient to walk. Even the patient unable to walk at all, they will help to move. So it can be passive help or passive movement, or it can be assisted movement. Okay, next. So here also just another picture. Okay, at their place at also rehabilitation Malacca. So all these can help the movement. So in additional, we have the screen at the front. So we added virtual reality also, game also, so they will be more excited. Okay, next. So another place that use robotic rehab at our one of the biggest rehab hospital in our country, which is Region Rehab Hospital. So for example, we can see there FitMe. So this one interactive full body rehabilitation system with a structured exercise for patient to practice with semi-supervision. So it can be either semi, it can be full supervision. So we can set from the technology from this mission. Then we have also arm motors and tool. This one we provide mostly for the upper body movement. Same goes the robo hand. This one we target mostly for the hand movement. Then we have Bionis. So this one use functional electrical stimulation to activate the nerve that contribute the muscle in your hand and forearm. For this one actually same like if we are physiotherapy, we know there is one machine we call it NMES, neuromuscular electrical stimulation. So this one is the easy to say higher technology of the NMES. So easy to say this one we can stimulate the nerve in order for the patient to move. Okay, next. Then next thing that in our country we have virtual reality or VR or AR. Okay, these two technology are becoming increasingly common in rehabilitation program because their versatility and effectiveness in engaging patient. Like previously, like I said, when the patient do exercise, then there is a screen at the front, so we can see the movement. We can see the effect of the movement. They will also play a game, so they will be more excited. When they are more excited, they can produce a more significant improvement. So VR physical therapy has application for many different types of patient. It can be useful for rebuilding strength and range of action, gait and balance learning, or practicing fine motor skill. VR therapy is also useful in neurological rehabilitation for people who have experienced a stroke, traumatic brain injury, or other similar condition. Okay, next. So again, same thing, mostly being used at social rehabilitation worker. So we can see that there is a machine there. Then at the front, they put a screen as a virtual reality. So the patient uh, can get excited and motivated to do the exercise rather than only do exercise one-on-one with the therapist. When they see the picture, when they see the screen, so they got more excited. So they will do better. Okay, the outcome also will be better. Okay, next. So this one also another type of available robotic rehab at social rehabilitation market. So this one mostly for the upper limb. So there is a game at the front. So they will do the movement. So like I said before, it can get the patient more excited. So outcome will be better. Okay, next. Then we have also been used in our country is 3D motion gait analysis. So this technology are useful in training gait and posture. A smart device can provide alerts when the wearer needs a reminder to focus on healthy movement. This device also provides helpful biofeedback for patients working to strengthen their brain to body connection. Combined with other rehabilitation tools like VR, they can help patients improve mobility and coordination and build overall body awareness. As biomechanical sensors become smaller, more powerful, and more economical, they are sure to see increasingly widespread uses in all types of physical therapy settings. Okay, next. So, one type of the 3D motion gait analysis that at our country being used is semi 3D motion gait analysis. So this trusted and deployed by some of the largest sport corporation. Usually this one we use for sport, but usually it's not really we do for patient. Mostly we done for research purpose. So this company CME enables user to extract position data, 3D joint location, acceleration data, joint forces through our AI powered technology and data processing system. Okay, next. So one place that use this 3D motion gait analysis is at our university, Masa University. So we can see that there is a six camera there. The function is that we capture motion. So from the capture motion, we can see in the screen. Okay, next. Okay, here is the screen. As we can see, there is a dot there. Okay, that dot actually is a marker. This marker we will put on the patient body. Then we ask the patient to move. Then we can record this video based on the markers that been put on the patient body. So next. So here are the markers. So easy to say, this thing we put on the patient bodies. Then we ask the patient or the person or athletes to move at the walking parts of the machine. So this will capture the movement of the patient or the athletes. Okay, so once we capture all this thing, then we can see the result. Okay, next. So we can see something like this when we see the result from the motion capture. So for example, the first one, the left side of the our screen, actually the movement of walking. So from here we can see, is it maybe we can see the dot, maybe one of the knee not in align with the hip or ankle. So we can see, oh, maybe got a problem with the knee. We can see also at the ankle, for example, maybe the dot, the left side more higher than right side. So we can compare, maybe got muscle imbalance there. Same goes to the next picture. That's next picture is the actually squatting. So as we can see, at the right side of the knee is deviate to the right side, which means maybe got some issue with the buttock muscle or glute muscle. Maybe one side is hyperactive, one side is weak. So when they squatting, there will be a deviation of the knee. As our if we do with our naked eye, sometimes we didn't notice the issue. That's why when we use this, we can see very well with this, is there any deviation in the posture or in the movement. So that's a very good benefit coming from this technology. Okay, next. So here also we got another type of the 3D gait analysis, but this one mostly for the movement. So these two camera, same goes to the 6 camera just now. We capture movement, then we can see the angle of the movement. Okay, next. For example, this one, when the patient start standing, we can see the angle. So we ask the patient to squatting or do any type of movement, then we can see, is there any increasing of the what we call it angle. We can see this one on the right side, then you can do on the left side. So we can see right and left. Is it the angle is the same? Maybe not same. So it can be due to muscle issue, all those things. Maybe one side is tight, one side is weak. Okay, next. So gamification. This one actually quite similar with the virtual reality, which means combined with virtual reality and game. So this will make the patient more excited. Okay, when they get excited, same point like I said before, the outcome of the rehab will be better compared to when just one-on-one is the physiotherapist. Okay, next. For example, this one we can see in this also rehabilitation marker. Okay, so basically they are playing game, combine virtual reality and the technology robotic rehab. So they like combine 3 things: robotic rehab, virtual reality, and so game. All these things can make them produce a better outcome and they are more excited. Okay, next. Then we have also tele-rehab. This one also we starting to do in our country, but not much, but we starting to do. So the thing is, because tele-rehab can, like I said previously, we can reduce the gap between patient and the what you call it, patient and the physiotherapist. Why? Because even the gap, I mean, it's not the gap, the distance. The distance will be far. Okay, because the patient can stay at the home. I mean, in one-on-one situation, when we see in the screen, rather than we see face to face, sometimes in the screen we see we put more attention, right? Because it's totally one-on-one. So and also we can, as we can see in the second step, second point, telehealth physical therapy is a game changer for expanding access to care in area with few healthcare providers. For many patients, the chance to consult with a qualified physical therapy can be different between speedy recovery and lingering from that affect many aspects of the life. Okay, next. So one hospital or medical center that starting to use telerehab is Sunway Medical Center. So this one actually one of the most famous medical center or hospital in our country. So they are starting to use telerehab part of their rehabilitation program. Okay, next. Physio center also start using, for example, first physio, your physio, they are start using telerehab, but it's not in that level that totally been utilized. They are in first step, easy to say, starting to use. And actually not only these two, quite many, just I put a few only, because we are starting to use telerehab in our country. Okay, next. So right now we logically we see there is a proof that technology can improve outcome of the patient. But is it proven in terms of research? Okay, so right now we want to see, is it reliable to use AI or technology in physiotherapy field? Okay, next. So according to Chong 2021, meta-analysis have indicated that technology-assisted cardiac rehab, okay, this one in terms of cardiac rehab, demonstrate comparable result to conventional center-based cardiac rehab. So technology cardiac rehab is a potential alternative to remove cardiac rehab barrier. So technology in terms of cardiac rehab also been proven. Okay, so same goes the second and third from Rintala. So this one they use systematic review. They do systematic review, then suggest that effectiveness of technology based distance physical therapy for improving gait is proven. So it can prove gait, it been proven already. Then also in terms of technology based distance physical therapy rehab, increase physical activity among person with multiple sclerosis. Okay, so all this been proven. With technology, we can improve outcome of our patient. Okay, next. Another a few what call it evidence. According to Saposnik 2010, VR and W11 WII. So this one actually a combination of virtual reality with the game. So this one been proven effective for motor recovery of stroke. Then same goes to Asad Zadeh 2021. So potential effectiveness of virtual reality based aside therapy for the improvement of rehabilitation outcome. Then according to Wang 2019 also is good to use technology in post TKR patient. This one more to the musculoskeletal problem. So with musculoskeletal problem and neurological problem all been proven good will produce good outcome if we use AI or technology. Okay, next. So future of the physiotherapy field. So we know with the advancements of this technology, we got more outcome. But as you can see, the second point, as a tools like AI become increasingly widespread, physical therapists must find ways to maintain a human touch in their practice. So we come back to basic. Even though there is advancement in the technology, we still need to know. We need to touch the patient. It's not like we really need to touch. We need to touch the patient so we can got a psychological connection. So they trust us more compared to robot. Okay, robot is robot. They don't have feeling, right? So there is no connection between therapist and patient. So God also study said when we have connection, psychological connection with therapists, we got better outcome also. It's not like totally we use technology to improve our patient. Okay, for example, we do a lot of manual therapy. So all this manual therapy can increase. Still got research that say with manual therapy can increase outcome of the patient. So it's like we have to. It's not we totally neglect manual technique. So we have to parallel between both. So we need to be in accordance with the technology, but still we touching or manual skill. Okay, next. Okay, so basically that's it for me. That's my reference. So the next, my friend. So thank you. I'm so sorry again. Just now I got issue with my what we call it mic. I don't know why. I test before last night. I test already okay, but suddenly today it's got issue. I don't know. I'm so sorry to drag the time. Okay, thank you so much. Assalamualaikum. Yeah.
Thank you very much, Mr. Al-Kausar, for your material. It is so interesting. You share many things about AI and also visual therapy, especially in Malaysia. I hope you can stay for a moment, because after this we still have 2 more speakers, and then after that I'm going to follow by the discussion, and some of the audiences will ask some questions to the speaker of this session. Okay, ladies and gentlemen, we are going to the next speaker. He is a professor, vice rector of the Moscow City University at Samara campus, Russia. He is also head of the Samara City Education Center Municipal Authority. He is an author of more than 110 scientific papers in the field of philology, teaching method, linguoculturology, management, business communication. He is also a member of the team of author of one of the largest publishing houses of the Russian Federation. He really loves traveling, swimming, gardening, and cooking. And today, he is going to share his insight about neural network, trend, and development prospects. Ladies and gentlemen, please join me in welcoming Professor Elsin Kasimov. Good morning, Professor Kasimov. Hello, Professor Kasimov.
Yes.
Okay, thank you very much for making it to our international webinar. So are you ready to deliver your material today?
In just a moment.
Okay.
There's some problems with voice. Yes.
Okay.
Hello.
Hi.
Yes, I'm ready, and I need my presentation. Okay.
Okay. And I would like to remind you that your time is 15 minutes starting from now. Thank you very much.
Okay, thank you. Dear colleagues, dear participants of the conference, and dear our Indonesian friends, I'm very happy to be here among you, and thank you very much again to the possibility again to the conference. Today, I would like to talk about artificial intelligence, about narrow system, and of course some facts about our language system. As far as you know, language is a base foundation human ability. Research has long probed the functional architecture of language in the mind and brain using diverse neuroimaging, behavioral, and computational modeling approaches. However, adequate neural mechanistic accounts of how meaning might be extracted from language are sorely lacking. Here, we report the first step toward addressing this gap by connecting recent artificial neural network from machine learning to human recordings during language processing. We find that the most powerful models predict neural and behavioral responses across different datasets up to noise levels. Models that perform better at predicting the next word in the sequence also better predict brain measurements, providing computationally explicit evidence that predictive processing fundamentally shapes the language comprehension mechanism in the brain. And of course, when we say about the artificial intelligence, we know that artificial intelligence in the modern world, in the society 5.0, is a significant paradigm that has significant influences on a variety of disciplines, including education. There is a lot of misunderstanding and uncertainty surrounding the word. Therefore, the focus of this blog is to give some real instances of how artificial intelligence is being utilized to improve language acquisition, and why even language teachers should welcome it rather than fear it. Artificial intelligence is infiltrating our everyday lives at an increasing rate. Is e-commerce, marketing, financial tech, manufacturing, and automotive industries. Artificial intelligence is already a key component. It's past time for artificial to be used in foreign language learning and teaching. We've been attempting to modernize the learning process with artificial intelligence language learning for several years. However, nothing new has transpired in the sector since the introduction of online learning. Students, instructors, and the corporate sector will benefit from neural network capabilities combined with artificial intelligence-powered language learning. In the future, artificial intelligence with a written or vocal interface is expected to make our lives simpler. Companies based in Silicon Valley paint a vision of the future in which initiative language interaction with a virtual interlocutor plays a crucial role. Please, the next slide. Thank you. We need to remember that artificial neural networks and deep learning are but one set of techniques for developing solutions to specific problems. Right now, they are the big things. Opens Richard Young, founder and lead futurist of Intelligent Future Consulting and author of The Heart of the Machine, Our Future in a World of Artificial Emotional Intelligence. He adds, in that old saying, when your only tool is a hammer, everything looks like a nail. Except everything isn't a nail, and deep learning doesn't work for all problems. There are solves all sorts of developments to come in the next couple of decades that may provide better solutions. One-shot learning, contextual natural language processing, emotion engines, common sense engines, and artificial creativity. Basically, a neural network is a modeling of how the human brain works when processing information. It is an adaptive system that, through training, learns and continuously improves to model relationships and patterns between data, provide solutions to complex problems, and simulate natural language processing. This network contains neurons of nodes basic units, interconnected and organized in layers. There is an input layer which receives the input data, one or more hidden layers which propagate the data, and an output layer which sends the results of the analysis of neural work. The next, please. Thank you. Neural networks have been experiencing significant growth and development in recent years. Here are some trends and development prospects for neural networks. You see market growth, software tools, application challenges, integration system, and support system for decision making. About market growth, okay, the global neural network market is expected to rise at a considerable rate between 2023 and 2030, with an annual growth rate of magnificent. The market is driven by investment in artificial intelligence, cloud disruption, and the availability of advanced analytical tools and prediction solutions. You will say about software tools. Of course, neural network software framework such as TensorFlow, Keras, Caffeine, and others system provide comprehensive tool sets and programming interfaces to simplify the development and deployment of neural networks. These tools are constantly being improved upon to enhance their capabilities and make them more user-friendly. Applications. Neural networks are used in various industries, including manufacturing, airplanes, defense, healthcare, finance, retail, and energy and utilities. They are employed for tasks such as pattern recognition, image processing, natural language processing, and predictive analytics. The future of neural networks lies in the ability to solve complex problems and find trends in large quantities of data. If we say about challenges, despite their potential, neural networks face challenges such as the need for extensive preprocessing and future engineering. Engineering sensitive to the choice of loss function and optimization algorithm and the requirement for large amounts of data and experienced professionals. Overcoming these challenges will be crucial for the further development and adoption of neural networks. Integration with other technologies. The integration of fuzzy logic into neural network is one of an area of future research and development. This integration could enhance and capabilities of neural networks and make them more adaptable to real-world problems. And the implementation of neural networks and artificial intelligence should be seen as a support system for decision making rather than a substitute for human intelligence. And we say about our brain and how do brains learn. Please, the next slide. It's a mystery, one that applies both to the stronger organs in our skulls and to their digital counterparts in our machines. Even so, artificial neural networks are built from elaborate webs of artificial neurons, ostensibly mimicking the way our brains process information. We don't know if they process input in similar ways. There is a been long-standing debate as to whether neural networks learn in the same way that humans do. Natural and artificial networks learn in similar ways, at least when it comes to language. Neural networks learn language through a combination of input data, training, optimization process. Here a step-by-step overview of how they acquire language skills. Input data, neural networks are fed with large amounts of text data, such as books, articles, social media posts, statistical patterns and relationships between words and phrases. Distributed representation, neural network language models exploit their ability to learn distributed representation, which reduce the impact of the curse of dimensionality. These representation capture the statistical characteristics of the distribution of word sequences in a natural language, allowing the model to make probabilistic predictions of the next word given preceding ones. Training. During the training process, the neural network adjusts its internal parameters, weights, and biases to minimize the difference between its predicted output and the actual target output. This is typically done using a technique called backpropagation, which propagates the error from the output lower back through the network, updating the weights and biases accordingly. Language modeling. Neural networks, language models assign probabilities of word sequences and predict upcoming words. They can be used to generate text, autocomplete sentences, or assist in various natural language processing tasks. Researchers have developed techniques to speed up probability prediction and gradient estimation, making neural network language models and more efficient and effective. While neural networks promise in learning language, there are still challenges to overcome. For example, current models are trained on significantly more data than a typical child has access to. They may not fully capture the complexity of human language learning. However, ongoing research and advancement in neural network models continue to improve their language learning capabilities. The next, please. Thank you. In the digital age, in a period when we use artificial intelligence, where we use narrow systems, is one of the most moment in our world, of course, the communication, and I like say some words about it. About the next way is a communication. In the digital age, communication has become more complex and diverse. People communicate through various digital channels, such as, social media, instant messaging, email, and others. As such, it is essential to develop communicative competence to communicate effectively in this context. And a study identified 6 distinct competences required by HR analyst, including consulting, technical knowledge, data fluency, and data analysis. And HR and business acumen and communication. And communication is what is one of the most critical competence in the digital age, in the artificial intelligence age. And it involves not only linguistic knowledge, but also the ability to use digital tools and technologies effectively. And the next, please. And acquiring communicative competence, the next slide, please, in the digital and age requires a combination of technical knowledge, social skills, and digital literacy. Here are some ways to acquire communicative competence in the digital age. Develop digital literature skills. Digital literature skills are essential for effective communication in the digital era. It involves the ability to use digital tools and technology effectively. A study suggested that developing digital literacy skills can help learners develop communicative competence, practice communication skills. Communication skills can be developed through practice. Learners can practice communication skills by engaging in various digital communication channels, such as email, social media, and others. Learn social norms and cultural conventions. Social norms and cultural conventions play a crucial role in effective communications. Learners can learn social norms and cultural conventions by engaging with people from different cultures and backgrounds. Feedback is essential for improving communication skills. Learners can seek feedback from peers, mentors, and instructors to improve their communication skills. And on the other hand, digital technologies have made communication more open and accessible. On the other hand, they require new skills on the part of people. The relevance of the research is also confirmed by the shift of cultural vectors towards Asian and Pacific cultures, by change in approaches to oral presentation during international events. There are tendencies for speakers to deliver their speeches without the use of simultaneous translation and other translation resources. related significantly, increases the requirements for speakers' language and background knowledge, especially in the areas of high-level professional interaction, meeting of high-stakes, high-level forums and others, which now often takes place online. At the same time, understanding of communication as a certain code system makes it possible to present the discursive process as an exchange of codes of various degrees of openness, including cultural and linguistic codes at the same time. Assuming that code represents a unit of information, we find that in the course of cross-cultural communication in new era, the artificial intelligence, one can observe an exchange of cultural codes in which features of national mentality are included along with internal intention of speakers. And in other words, in a new era, in era of society 5.0, successful communication in each field case depends largely on the proficiency of communication, linguocultural decoding, and of course some other skills. I tried to present some idea about trends, about new roads in our future, and I try to give you some ideas which in which ways we work, because is one of the most aspects in our life, of course, using some skills, and our brain and our communication will help us to understanding in our new modern world. Thank you very much again for the possibility to be among you, and we hope that we continue our communication.
Okay, thank you very much, Professor Kasimov. Personally, neural network is something difficult or heavy for me, but it is very interesting. Ladies and gentlemen, I'm going to open the floor for question session. So you may raise hand, and then please state your name and affiliation and address your question. Okay. Or you may type your question and put it on the chat box. So I'm going to read your question. I'm sorry, Mr. Muhammad Al-Kausar, are you still with me?
Yeah, I'm still here.
Okay. Yeah, please wait a moment. If you have some question, I'm going to invite all of the participants. You may raise your hand, and then I'm going to assign you, and you can ask a question. Okay, someone is raising her hand. Please, operator, help me.
Okay. Here are the question, right? So has all the technology used been validated and safe to use? So basically, in terms of validation and safe to use, before they've been integrated or before they've been used, they already been validated and safe to use. So every machine that been used, for example, like I show you just now, the Cyberdyne machine, all have the specific safety measure. They have the button for the machine to approach. I mean to say, straight away stop. Got okay. That's why all already been validated and safe to be used. Okay. The next question just now. Sorry, I missed out. How if there are gaps or human errors in implementing the technology? Okay. So, human error, yeah. Because what I explained before, sometimes human error can happen when we do our assessment or when we do our treatment. That's why if we use technology, the human error can be reduced. Okay, that's why there is a good opportunity if we adapt or use our treatment or improve our treatment in accordance with the technology and AI. But again, that we cannot totally abandon manual technique, the power of human touch, the psychological connection between patient and therapist when we touch. That's why it's not we totally neglect, we left all the manual techniques. We have to apply manual techniques, one-on-one coaching, assisting our patient to move by our hands, all these things. We cannot simply neglect all these things. So all these technology and manual technique and manual action have to be in accordance with our era right now. So it's not technology better than manual, or it's not manual better than technology. So all have to be in accordance. All have to be progress time by time. Yeah.
Okay, thank you very much, Mr.
Yeah.
Kauthar.
Yeah,
Someone
thank you.
is raising her hand, so I'm going to give the chance to her. Please state your name and affiliation. Thank you.
Thank you,
Yeah.
Okay, hello, Mr. Kauthar. I would like to ask you about actually, I have question for both Mr. Kauthar and also Professor Asif. The first one I would like to ask to Mr. Kauthar. My question is about you said in your presentation that gamification harness our desire to accomplish goals and be rewarded, right? And it's quite effective in motivating psychotherapy patients to continue their treatment plans. And my question is about the challenges faced in implementing it. For physiotherapy, how to addressing these challenges? Okay, thank you. And then,
Sorry. Yeah. Sorry. One more time. How to address the what? Sorry, not very clear just now.
okay, my question is about the challenges faced in implementing it.
Challenges,
For,
is it?
yeah.
Challenges. Okay. Okay.
For the gamification, and also
Okay.
how to addressing these challenges.
Okay. Understood. So, like I said, in our country, I think basically physical therapy is all about manual. Easy to say. We coming from manual technique. Okay, manual technique, a lot of touching. So right now, some person, the one maybe the older people, older top, said manual is the best. But right now the challenges is easy to say, we got technology and there is a gap between manual and technology. So in order for us to reduce the gap, so we have to know all these manual technique and technology have their own benefit, and sometimes in terms of to implementing the technology also have challenges, right? So that's why we need to know truly, we have to really understand what technology can bring. For example, the challenges that we got when we want to implement technology is money. Okay, money, safety measure, then is it totally been proven? Yeah, that's why all these things needs time by time. Need more people to do more research. Some person totally reject technology because they said, "Oh, human touch is the best." Some person said, "No, human touch, yes, God, what you call it, the importance." But they said, uh, better right now because technology keep developing, so we have to follow technology. So here and there we got different thought. That's why, like I said, right now both have their own advantage. Manual technique, human touch have their own advantage. Technology have their own advantage. So all these have the challenges that we have to overcome. In order to overcome all these challenges, we have to know very details what's the difference between these two. What technology will bring, what manual technique will bring, and for over the time period, we have to apply both. We no need to neglect either two. Human touch, personal coaching, personal assistant, I mean in terms of treatment, the thing still do, but we can adjunct with technology. Or we can prioritize technology more than we adjunct the technology with human touch or human coaching. Okay, that's my answer. Yeah.
Okay, thank you, Mr. Professor. So, it's time right to socialize the technology or implement the technology for the patient.
Yeah.
Then, Mr. Reza, I have a question for Professor Elsie Gasimov. How are you, Professor?
Okay, you may ask question to him.
Okay, your matter is very interesting. So the neural networks and artificial intelligence, right? So, I have two questions here. The first one is about, as I know that neural networks and artificial intelligence are also presented as a tool for conducting almost all types of business, production, medicine. So the question I would like to ask is about how safe of using neural networks, and also is there any theater of neural networks? And then my question is about your presentation is about neural networks are basically for analyzing, forecasting, and also recognizing objects. And the main issues is that one can fool a neural networks. So the scientists use it to verify the network's resilience to non-typical situation. How to deal with that such condition, Mr. Professor Elsie? Thank you.
Sorry, Professor Gasimov, are you still there? Hello, Professor Gasimov? You still with us? I'm so sorry, I think there is a technical issue that happens to Professor Gasimov. So right now, he cannot answer your question. Do we still have another question that is addressed to Mr. Alkausar? We can keep this question first. Yes, sorry.
I think my question for Mr. Alkausar is enough.
Okay.
Thank you,
Yes.
Mr. Alkausar.
Yeah.
Sorry. Mr. Gasimov is not answering your question because he has a technical issue. Do we still have another question from other audience? Okay, so there are several questions that are addressed to Mr. Muhammad Alkausar. Should there be regulation or guidelines in placing to govern the ethical use of AI in patient rehabilitation, and if so, what should they entail?
Okay, so I answer the first question first. Okay, so yes, for sure we need ethical issue, or I mean the ethical guideline for this, because sometimes when we use AI or technology too much, sometimes we didn't really how to say not really thinking about ethical issues. So what we need to do, have to apply something that related to the comfortability of the patient, wanting safety measure to the patient. So make sure all this issue, all this technology have their own validation. Is it is approved already? Is it we can use all this in any type of setting? Is there any risk? Is there any potential risk? So all these things have to be appointed when we want to implement certain type of technology or AI. Okay. Next question. So how can AI supervise? We design to promote patient autonomy and empowerment during the revolution while respecting ethical principle. Okay. So easy to say AI need actually the answer quite similar with the first one. We need to make sure all the technology have their own safety measure and in terms of autonomy of the patient. So when they make all this technology, they already make sure this technology can give autonomy to the patient, like the available ROM, range of motion. Then from there, we know until where this patient can move. So actually, we give the autonomy to the patient. So the AI or the technology only can follow whatever the patient able to do. Okay. Basically, I think I answered the second question. Okay. The next one.
Interesting. What
Okay.
measures can be used?
Yeah. What measures can put in place to continuously monitor and evaluate ethical implication of AI technologies in patient rehabilitation to ensure responsible and beneficial use? So easy to say, almost the same thing for sure is safety measure. Okay, so safety measure have to be there, and patient what you call it, patient how to say patient comfortability, yes, patient comfortability, and all this is it been proven with research? Must coming with research evidence. The latest research evidence, all this technology can be helpful or can be used by our current situation or by our current place, for example, in physio center or in hospital. Yeah, I believe I answered the question. Yeah.
Okay, thank you very much, Mr.
Yeah.
Alkosat, for answering the question. I would like to apologize because Mr. Kasimov cannot answer the question from Mrs. Siska. So I think this is the end of the discussion session and we are going to move to the last speaker. But before that, please give big applause to our speaker. Okay, ladies and gentlemen, the last speaker, I would like to introduce him briefly. He is a researcher in public law and political science of Morocco. He is an international speaker and has visited Indonesia several times. And he is an online visiting lecturer at Universitas Pancasakti Tegal. Today, he is going to share his insight about the role of civil society in economic development in Morocco. Ladies and gentlemen, please welcome Professor Youssef Bakir. Assalamualaikum, Profesor Bakil. Can you hear my voice?
Hello and good morning, everyone.
Okay, good morning. So it is nice you are
Morning.
here with us. You are going to share your material upon the role of civil society in economic development in Morocco. and we are going to give you 30 minutes and starting from now. Time is yours.
Thank you so much. Good morning, everyone. Happy to be here with you today. My presentation, actually, it's about the role of civil society in economic development in Morocco. So as an introduction of my presentation, as a part of the 2011 constitutional revision and the context in which it took place, the Arab Spring, a new constitution was... Hello? My voice is okay? You can hear my voice? Okay. A new constitution was adopted with very important constitutional novelties supporting the human rights situation in Morocco and with new principles in the context of modernization of the state and adoption of the concept of the rule of law. Among these new concepts and related to our subject, we will talk about the concept of participatory democracy as one of the concepts created in the Moroccan constitutional and legal system. This concept is considered to reflect democratic practice in Morocco after 2011. It establishes new rules for democratic practice, allowing citizens to participate in decision-making and monitor the execution and evaluation of this decision. The Moroccan Constitution of 2000 defined a series of articles to frame the concept of participatory democracy. Like an example, Article number 6 and Article 12 and Article 13, and Article 14 and 15, and 136 and 139 and 156, and Article 156 and 59. The plan will be inserted below to help the readers to touch all the points which we approached on this subject. The first part, we will talk about the conceptual framework. Exactly, we will talk about the participatory democracy and civil society and economic development. In the second part, we will talk about the role of the civil society in economic development in Morocco. We'll divide this part to two parts. The first one, we will talk about the impact of civil society and the economic situation, and the second one, we will talk about the role of civil society in the evolution of the social and economic situation and in the reduction of poverty. So we'll start with the first part about the conceptual framework. We will start by participatory democracy, the definition of participatory democracy. An etymology from the Greek demos, people, and kratos, power, authority, and from the Latin participatio, to participate. Participatory democracy refers to all the devices and the procedures that make it possible to increase the involvement of citizens in political life and to increase their role in decision making. It finds its basis in the shortcoming of representative democracy. Parliament not representative of the diversity of society, remoteness of elected officials from the fight and from daily, really, feeling for citizens not to be understood by politicians, distrust of politicians, weak check and balances, increase in abstention. Participatory democracy is inspired by concepts that were implemented from the 1916 in many companies in order to improve the organization of workstation participatory management. Compare it to the to representative democracy and direct democracy. Participatory democracy is presented as a mixed system in which the people delegate their power of representatives who propose and vote on laws, but nevertheless retain the power to size themselves of the matter. Some questions. The characteristic of a participatory democracy are the extension of the right to vote and its frequency, accompanied by legislative initiative, the establishment of an organized system that ensures that all constructive and new ideas from citizens will be effectively considered. A system of participatory democracy will be all more sustainable when all the measures decided upon are acceptable to the vast majority of those concerned and go to the direction of the common good. Criticism of participatory democracy mainly focus on the notion of participatory democracy, which is often only a simple rhetorical discourse without concrete reality. It is sometimes associated with populism. The representative of the citizen participating in the debates, the role of councils and committees, which is often limited to the consultation aspect, forgetting the exchanges between actors aspect. The difficulty of knowing whether the opinions expressed are based on objective consideration of in defense of personal interest. Difficulty of verifying the veracity of the information used for the argumentation. The success of participatory democracy would come from democracy leaving little opportunity for citizens to participate effectively. Now we will move to civil society. For a country, a nation, civil society is all the players and association, more or less formal organization, movement, lobbies, interest group, think tanks, and others, which have a non-governmental and non-profit character. It constitutes a form of self-organization of society in citizen initiative outside the state of commercial framework. Its objectives are based on the general or collective interest in various fields: socio-political, solidary, humanitarian, ethical, legal, environmental, scientific, cultural, and others. For the European Union, in its white paper on governance, civil society brings together in particular trades union and employees, the social partners, non-governmental organizations, NGOs, professional associations, charities, grassroots organizations that involve citizens in the local and municipal life, with a specific contribution from churches and religious communities. For Larry Diamond, professor of political science and sociology at Stanford University in the United States, as a definition of civil society, he say that it is the field of organized social life which is based on voluntary services, spontaneity, self-sufficiency, autonomy vis-a-vis the state, which is bound by a legal order or a set of human rules. So it should be noted that some supporters of economic liberalism in the United States consider that the market economy is a part of civil society. A distinction should be made between society as a group of citizens and civil society made up of associations or organizations that are supported to be legitimate to present the will of citizens. Civil society has a perception of societal issues which is unique to it, and which is not necessarily representative of society, was a wall since to 1919. Civil society has developed strongly in terms of influence and intervention capacity, particularly in international development, aid, and political life. It manifests itself more particularly during elections, where it mobilizes for the sensibilization and education of the electorate. Two types of historical and normative reference dominate the practice and analysis of real civil societies. One distinguishes a set of NGOs constituting the fabric of civility in the sense of the peaceful expression of differences and disputes within the framework of the rule of law. It postulates a functional relations between civil society and the state, the foundations of a liberal political order, the order which participates directly in the return of civil society, considered it in the relationship to the state in the mode of dualism. Organized in a completely independent manner from state bodies, civil society would be the vector of more conscience and of all alternative projects tending to endowment the foundation of an authoritarian political order. Now we will move to the last definition. It's about economic development in etymology from the Latin of prefix of cessation of negation and of velar. To veil, to cover, to wrap. Development is the act of growing, of progressing, of expanding, of becoming more complex over time. Economic development refers to the positive development in the structural changes of a geographical area or a population, demographic, technical, industrial, health, cultural, social such changes generate the enrichment of the population and the improvement living conditions. This is the reason why economic development is associated with progress. Economic growth is only one component of development. The latter can be measured using indicators such as the GDP, the GNP, the gross national product, the HDE, Human Development Index, and the BAP 40, its barometer, inequalities and poverty, and the HPI, Human Poverty Indicator. In economically advanced countries, development is generally sought by encouraging innovation via research, investment, education, and increasing legal certainty. In emerging countries, development is mainly based on the exploration of natural resources and the low cost labor. And in his speak in Economic Development and Economic Growth, Bernard Bilodeau says that economic development in then convinced distinctly from growth. It is the qualitative process which inspires growth, that which presides over the accumulation of capital and technical progress. The link between development and growth is therefore one-to-one. There is no growth without development and no development without growth. This often leads to confuse the two. Moreover, some even consider it superfluous and adds the qualifier economic if we retain that these two terms only have meaning in economics, that they relate only to the economy, that is to say to well-being procedures by rare goods. Now we will move to second part of our presentation. It's about the role of civil society in economic development in Morocco. And we will divide this part to two parts. The first one, it will be about the impact of civil society and the economic situation, the main sources for foreign exchange are tourism, foreign direct investment, and remittance from Moroccan residing abroad. Civil society also help bring foreign exchange, a significant part of donor support to civil society association based primarily on a non-profit goals. And it relies primarily on funding and grants to conduct on to its activities. Without the above, we clearly see the role of civil society associations in providing foreign currency and its positive impact on the economic situation. Regarding the role of civil society in reducing public spending, Morocco bears a great deal of financial burden links to public spending in several sectors, employment, strengthening of official protection, achievement of financial and economic stability, and provision of resources for development spending. Civil society associations reduce governmental spending and help it fulfill its key roles, providing employment opportunities, full-time, part-time, or even in training. There are more than 400,000 associations in Morocco and more than 20,000 cooperatives. Imagine the extent of the employment opportunities offered by this association and cooperative, as well as the voluntary work carried out by this association, where this association contribute to the preparation and the training of young executives who work in many fields, whether in the fields, the environment, sports or health, development, or public affairs engineering. Now we will move to the last part of our presentation. It will be about the role of civil society in the evolution of the social and economic situation and in the reduction of poverty. Morocco's experience in participatory democracy and civil society, with all its components, especially associations and cooperatives, is an innovative experience where it has even a model and an example of poverty reduction and change of the social and economic situation, and we will address both the role of association and cooperatives in reducing poverty and changing the social and economic situation. At the level of association, the number of associations in Morocco exceed 400,000 associations working in several fields: public affairs, environmental sustainable development, and sports, arts, and other fields. These associations play a major role in changing the social and economic situation of their members and citizens in general. Especially associations work in the field of social and economic development. These associations offer real opportunities for change through various activities, training, seminars, supports, courses, development projects, artistic and cultural activities. These activities contribute to the training, supervising, and production of future executives and managers. At the level of cooperative, the number of cooperatives in Morocco exceed 20,000 cooperatives, including 2.67 women's cooperatives. 67 of these cooperatives are active in the agricultural sector, and 16 in traditional industry, and 6% in the housing sector, and more than 500,000 people are involved in this cooperative, and 29% of them are women. According to the above statistics, these cooperatives are mainly active in the agricultural sector. Cooperative helps reduce poverty rates in the rural communities throughout income generating activities. For example, in certain villages, women meet regularly in a cooperative framework engaged in the production of honey, of breeding, or agricultural activities or traditional industries activities. These activities carried out by these women within the framework of cooperative bring them financial benefits through the sale of their products. Thanks to the above, those women have a financial income and through which we clearly see the role of this cooperative in the evolution of the social and economic situation of the citizen. All this is part of the social and solidarity economy. These cooperatives play a very important role in saving Moroccan families, especially rural families, from poverty and changing the social and economic situation of these families. As a conclusion of our presentation today, in this regard, we discussed the concept of participatory democracy from constitutional and theoretical point of view. We also discussed the concept of civil society as an element that can only live in participatory democracy. Also, we approached economic development as a reflection of the social and economic status of citizens. To start everything before we try to analyze the status and the role of company, civilian economic development, highlighting the activities of associations and cooperatives as component the most important in civil society, and the role of these various activities in achieving economic development. So I think that's all about my presentation. Thank you so much for your attention, and thank you so much. Thank
Open
you.
the floor for question session. I saw some
Mhm.
questions that are on our chat box, so I'm going to read it.
Mhm.
Okay, please wait for a moment. Okay, first question. What are roles of the civil society could it play to become a true partner towards economic democracy in Morocco?
What? Can you repeat the question, please?
What is the role of the civil society could it play to become a true partner towards economic democracy in Morocco?
That's what I talked about in my presentation. We can talk about the civil society as a partner in the social, especially in the social economic, because the civil society play a very important role in achieving economic development, because their associations and cooperative that the correct place that give opportunities for people, especially in rural villages, that can have benefits from their artisanal product or artisanal industry. So we can say that the civil society play a very important role in economic and social development. That's what I talked about in my presentation, and I give statistics of how many people works in cooperatives and in associations to have benefit from their works.
Okay, and then we still have a question.
Mhm.
It's from Chanatif, Rajamangala University. Does AI play a specific role in reducing poverty, especially in Morocco?
What? Can you repeat, please, the question?
Does AI play a specific role in reducing poverty, especially in your country, Morocco?
Yes, of course. I think the second question, it's have a relation with the first question. Yes, of course. That's what I talked about in the second part of my presentation, and it's about how the civil society reduce the poverty in Morocco. I will give you some numbers, some statistics. The numbers of association in Morocco exceed 400,000 association working in several fields and to, and 20,000 cooperative. These activities contribute to the training, supervising, and producing for the future executive and managers, as I say. And the cooperative, we have 2.67 women's cooperative, and 67 of these cooperative are active in the agricultural sectors, and 16% in traditional industry, and 6% in the housing sector, and more than 500,000 people are involved in this cooperative. So more than 500,000 people, and 29% of them are women. According to the above statistics, these cooperatives are mainly active in the agricultural sector. So cooperatives help reduce poverty rates in the rural communities through incomes generating activities. For example, I will give you an example. In certain villages, women meet regularly in a cooperative framework engaged in the production of honey or breeding or agricultural activities or traditional industrial activities. These activities carried out by these women within the framework of cooperative bring them a financial benefit through the sale of their products. So thank this women have a financial income, and through which we clearly see the role of this cooperative in the evolution of the social and economic situation and how it's reducing the poverty in Morocco, and especially in the rural area.
Okay. I guess I'm going to read one last more question. This is the last one. Question from Mr. Indrawan Adi Saputra from STMIK Amikom Surakarta. What challenges does civil society face in economic development in Morocco, and how are they addressed? I mean, how they cope with it? And there is any technology to overcome this issue, like economic development, which the Morocco government used in 5.0 society?
The challenges, maybe we can talk about the number of associations and cooperative is still not big. Even we have more than 400,000 association and more than 20,000 cooperative, but it's still not a big number. Depend the Moroccan country, because we have maybe 40 million people here. So it's a small number if we compare it to the number of people. And the other challenges, it's maybe about the fields of working, because the cooperative, it's work especially in the rural area. Maybe we can see in the future the cooperative works more in the cities also as well, also like the rural area. And the technology about the IT, I think yes, some associations work on this file about the digitalization and the numerization here in Morocco to help them to increase their activities and to have more networking on the world, on the whole world. So that's all about the challenges in my opinion. And thank you. So yeah, the main idea it's about increase the number of associations and cooperative here in Morocco.
Okay, thank you very much, Professor Basil, for answering the
Thank you.
question. If there are still some questions, I'm sorry because the time is up, so I cannot
No,
read
no,
the
no.
question.
I'm here to answer all the questions. I don't have any problem.
Okay, thank you very much, ladies and gentlemen. Can we give applause to our presenters today? Okay, thank you very much. As a gesture of gratitude, we would like to award our speakers today with the certificate.
Thank you.
Okay, I would like to express my gratitude to our speakers today, respectively to Mr. Didi Iman Margatot and then Mrs. Naning Tias Basari, Mr. Muhammad Al-Kautsar bin Harun, Professor Elsin Kasimov, and also Professor Yosef Bakil. And then the next session is photo session. I'm going to invite all of the audience to turn off your camera and put your beautiful smile so we can capture your moment. Okay. We are going to open the first slide. Please turn on your camera and then give your sweetest smile. Okay, I'm going to count down. 3, 2, 1, go. Okay, next, to the next slide. 3, 2, 1, go. Okay, and then the last slide. 3, 2, 1, go. Okay, thank you very much, ladies and gentlemen, for your time and your attention. I hope our agenda today is very beneficial for us for today and then in the future. I'm so sorry if I have so many mistakes. I think it's a wrap, and let's call it a day. So long, everyone. I'm Reza Mandira. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Time is given to the MC.
Reza and all of the speakers. Now we come to the closing session of this international webinar. We would like to say thank you so much to all of those participants on this webinar. Also, we ask apologies for all of the mistakes that we have had in this agenda, and we are so sorry for the inconvenience that have happened in this agenda. Thank you, everyone. Let's end the international webinar by saying Hamdalah together. Good afternoon, everyone, ladies and gentlemen. See you on the next international webinar event. Stay healthy, stay happy. Assalamualaikum warahmatullahi wabarakatuh.